Have you ever wondered if some medical tests could actually make you less healthy after 70? Last year, my Uncle George, a strong 74-year-old, went in for what he thought was a routine checkup. One test led to another: scans, biopsies, even surgery. But here's the shocking part: none of it was necessary. What began as prevention turned into a nightmare of hospital visits and complications. And he's not alone. Every year, thousands of healthy seniors are hurt, not by disease, but by overtesting. Stay till the end of this video, because I'll reveal the 5 health checkups that doctors now warn could do more harm than good after 70. Number 1. The silent danger of too much healthcare after 70. When we think of aging, we imagine more hospital visits, more checkups, and more tests. It feels logical. After all, prevention saves lives, right? But here's the uncomfortable truth. After a certain age, too much testing can become a silent killer. Doctors call it overdiagnosis, finding problems that would never cause harm in your lifetime. Imagine being told you have an abnormality. Your heart rate spikes, you lose sleep, and you start taking medications that cause side effects. Weeks later, you learn it wasn't serious at all. This emotional toll is real. Studies from the British Medical Journal 2022 found that nearly 42% of adults over 70 experience unnecessary follow-ups from screenings that detect non-threatening issues. And here's where it gets worse. Each follow-up brings risks. Blood thinners for false heart conditions, biopsies that cause infections, or anxiety that never leaves. We're told to trust technology, but the truth is, machines see things our bodies can easily live with. To make a long story short, the body after 70 isn't a battlefield, it's a balance. Testing it too much disturbs that harmony. The key is not more tests, but smarter ones, based on symptoms, not fear. Now, let's dive into the first big myth most seniors still believe: the annual full body scan. Number 2. The annual full body scan myth. You've probably seen those shiny advertisements. Get your full body MRI today. Detect diseases before they strike. It sounds like a dream, doesn't it? Who wouldn't want to catch problems early and live longer? But here's the truth your doctor might never tell you. Those scans can hurt you more than help you after 70. Let's break it down. Full-body CT and MRI scans can reveal something called incidental findings: harmless shadows, spots, or small cysts that have no real medical meaning. Yet once they appear on a screen, they trigger a domino effect. More scans, more biopsies, more anxiety. A study published in JAMA Internal Medicine 2023 found that over 30% of adults over 70 who had a preventive full-body scan ended up with follow-up procedures that did not improve their health or lifespan. Some even developed complications: bleeding, infection, or organ damage from surgeries done to remove benign growths. To make a long story short, technology can't always tell the difference between danger and noise. And as we age, our bodies collect harmless irregularities: calcium deposits, cysts, scars that look scary but mean nothing. Radiation adds another layer of danger. A single CT scan delivers a dose equivalent to 200 chest X-rays. Over time, that radiation can increase cancer risk, especially in people with slower cell repair due to aging. So here's the key question: if a scan doesn't change how long you live or how well you feel, is it really worth the risk? Doctors now suggest a more personalized approach: skip blanket scans and focus instead on functional health markers: mobility, balance, cognition, and daily vitality. Because the best measure of aging isn't what's inside a machine. It's how you feel every morning when you wake up. Next, let's talk about one of the most debated tests in senior medicine: the prostate cancer screening that may actually shorten lives instead of saving them. Number 3. Prostate cancer screening after 70. When it does more harm than good. Let's face it, few medical tests have caused more confusion among men over 70 than the PSA test. For decades, it's been marketed as the ultimate shield against prostate cancer. But here's the uncomfortable truth: after a certain age, the PSA test often finds problems that don't need fixing at all. The PSA, or prostate-specific antigen, is a protein produced by both cancerous and non-cancerous prostate tissue. As men age, PSA levels naturally rise, not always because of cancer, but due to harmless enlargement or inflammation. However, when your results come back elevated, what happens next? A biopsy. And that's where the real trouble begins. Biopsies in older adults can cause bleeding, infection, and even hospitalization. Worse still, they often lead to a diagnosis of slow-growing tumors, the kind that would never affect lifespan. But once the word cancer is on paper, fear takes over. Men rush into surgery, radiation, or hormone therapy, all of which can lead to impotence, incontinence, and chronic fatigue. To make a long story short, the treatment can be far more dangerous than the disease itself. According to the U.S. Preventive Services Task Force USPSTF, routine PSA screening is not recommended for men over 70. Why? Because for every one life saved, dozens are harmed by side effects and stress. The National Cancer Institute backs this up, reporting that most prostate cancers found after age 70 grow so slowly that men die with them, not from them. So what should you do instead? Focus on symptoms, not numbers. Trouble urinating, pain, or blood in urine. Those deserve attention. But a healthy, symptom-free man over 70 doesn't need a PSA test just to be safe. Sometimes doing less is the most powerful medical decision of all. Up next, we turn to a deeply emotional topic that affects millions of women worldwide. Mammograms after 75, and why some experts say they may cause more harm than healing. Number 4. Mammograms after 75. A controversial debate. For decades, mammograms have been hailed as a lifesaver, the golden standard for early breast cancer detection. But as women cross 75, something changes. The line between protection and overprotection begins to blur. And for many seniors, that yearly test might be doing more harm than good. Let's start with the facts. After 75, breast tissue changes. It becomes less dense, and the chance of aggressive, fast-growing cancers declines. However, the likelihood of finding slow-growing or harmless abnormalities actually increases. These findings often lead to biopsies, surgeries, and radiation, treatments that carry serious risks for older adults. The Harvard Aging Study 2022 revealed that nearly one-third of women over 75 who underwent mammograms received false positives, or overdiagnoses. That means their scans picked up something labeled as cancer that would never have caused symptoms or death. Yet, many underwent mastectomies, chemotherapy, or radiation anyway. Unnecessary suffering driven by fear. To make a long story short, just because something can be found doesn't mean it should be treated. And here's something else. Mammograms don't guarantee safety. According to the U.S. Preventive Services Task Force, screening after 75 has no proven mortality benefit for women with average risk. In simpler words, it doesn't extend life for most seniors. So, what's the alternative? Talk to your doctor about personalized screening. If you have a strong family history of breast cancer or carry genetic risks, like BRCA mutations, continue under guidance. But if you're healthy, symptom-free, and past 75, annual mammograms may bring more anxiety than assurance. Remember, health at this age is about quality of life, not just catching invisible threats. Next, we'll move to another test many older adults fear missing, but often regret doing too late: colonoscopy after 75. Why might this gold standard test be losing its shine with age? Let's find out. Number 5. Colonoscopy after 75, when risks outweigh rewards. Colonoscopy, the word alone can make anyone over 50 wince. For decades, it's been promoted as the ultimate test to prevent colon cancer. But after 75, the story changes dramatically. What was once life-saving may now bring more danger than benefit. Here's the reality. Colon cancer typically develops slowly, often taking 10 to 15 years to become life-threatening. That means if you're 75 or older and had a clear colonoscopy in the past decade, your risk is already very low. The problem? Many seniors are still told to repeat the test, despite new guidelines saying otherwise. according to the American Cancer Society ACS 2024 update. Routine colonoscopy screening is not recommended after age 75 unless there are clear symptoms or high risk factors. Why? Because the risks begin to outweigh the rewards. Let's break that down. Sedation and anesthesia can be risky for older adults, slowing heart rate, lowering blood pressure, and sometimes leading to confusion or falls afterward. The procedure itself can cause intestinal perforation, a tear in the colon, which can be fatal in seniors with fragile health. The National Institutes of Health (NIH) reports that for every 1,000 colonoscopies performed on people over 75, 6 result in major complications, far higher than in younger adults. To make a long story short, prevention has limits, and wisdom is knowing when to stop. If you're past 75 and symptom-free, safer alternatives exist. Tests like the FIT fecal immunochemical test or Cologuard can detect blood or DNA changes in stool. No sedation, no hospital stay, and far less risk. So ask yourself, would you rather chase every possible disease or protect the healthy years you have? The goal after 70 isn't to find everything wrong, it's to preserve everything right. Up next, we'll look at another common test that's quietly being overused, and sometimes overhyped, in older adults: bone density scans. You might be surprised to learn that doing them too often could do more harm than good. Number 6. Bone density tests. Why too frequent testing is unnecessary. If you're over 70, chances are your doctor has recommended a bone density test, the famous DEXA scan, to check for osteoporosis. It sounds harmless, right? A quick scan, no pain, no needles. But here's what most people don't realize. Doing it too often can lead to unnecessary treatments, anxiety, and even physical harm. Let's start with what the DEXA scan actually does. It measures how dense your bones are, a good indicator of fracture risk. But after 70, bone density tends to decline naturally, even in perfectly healthy people. That's not always a sign of disease, it's simply biology. Yet, when seniors repeat these tests every year, minor, normal changes can trigger alarms. Doctors might then prescribe strong medications like bisphosphonates, for example, Fosamax, Boniva, which sound protective but often come with serious side effects: jawbone decay, esophageal irritation, and atypical femur fractures. Ironically, drugs meant to protect bones can sometimes make them weaker when used long-term without necessity. A landmark study by the Women's Health Initiative (WHI) 2023 found that repeating bone scans every 1-2 years showed no measurable benefit compared to every 5 years, unless the patient had multiple risk factors like steroid use, smoking, or chronic illness. To make a long story short, overtesting creates overreacting. Experts now recommend that most seniors get a DEXA scan only once every 3-5 years, and even less frequently if results are stable. Instead of obsessing over numbers, focus on what truly strengthens bones: balance training, vitamin D, sunlight, and resistance exercise. Because the real danger to seniors isn't a bad score, it's a bad fall. Strength, not scanning, prevents fractures. Up next, we'll explore a common heart test that many seniors assume is protective, but that might actually open the door to unnecessary stents, stress, and surgeries. Heart stress tests after 70. Number 7. Heart stress tests. When they're risky for older adults. You've seen it in movies. A patient walking or running on a treadmill, wires attached to their chest, doctors monitoring every heartbeat. It's called a cardiac stress test, and it's one of the most common heart evaluations given to people over 70. But here's the problem. Many seniors taking this test don't actually need it. The American College of Cardiology (ACC) now warns that routine stress tests in symptom-free seniors can lead to a dangerous spiral of false positives, unnecessary procedures, and long-term complications. In fact, a 2023 Johns Hopkins study found that over 45% of stress tests ordered for adults over 70 were inappropriate, given to people without chest pain, shortness of breath, or any sign of heart disease. So what's the risk? A false positive result, which can make your doctor think there's a blockage when there isn't. This often leads to more invasive procedures like angiograms, cardiac catheterizations, or even stent placements. Each of those carries serious risks for seniors: internal bleeding, infection, or kidney injury from contrast dyes. To make a long story short, if your heart is doing fine, testing it too much can break it. Here's a better approach. Focus on function, not fear. If you can walk upstairs, garden, or take a brisk walk without chest pain or dizziness, your heart is telling you it's doing its job. Instead of stress tests, the American Heart Association recommends regular blood pressure checks, cholesterol management, and lifestyle-based prevention, diet, hydration, and movement. A 2022 Cleveland Clinic review confirmed that lifestyle modifications reduced cardiac events by 33%, outperforming most early detection tests in healthy older adults. So before stepping on that treadmill at 75, just to be sure, ask yourself, am I testing for a problem or testing my peace of mind? Next, let's talk about something equally important but rarely discussed: the psychological and financial toll of overtesting. Because sometimes the true harm of too many checkups isn't in the hospital, it's in your head and your wallet. 8. The hidden cost, psychological and financial impact of overscreening. Every test, scan, and screening might seem small on its own. A few minutes here, a few dollars there. But when you add them up, the costs aren't just financial. They're emotional. They're psychological. And sometimes they steal more from your peace of mind than they ever give back in health. Let's start with the emotional side. Imagine this: you're told there's a suspicious spot on your lung or a possible irregularity in your heart rhythm. Panic sets in. You can't sleep. Your appetite drops, and every ache suddenly feels like the beginning of something catastrophic. Weeks later, you find out it was nothing. Relief floods in, but the damage is already done. That fear lives on. This cycle of fear and relief is what psychologists call the skanxiety loop. According to the National Institute on Aging NIA, 2023, nearly 40% of seniors who undergo unnecessary screenings report lasting anxiety, even after being cleared of illness. That's because our brains remember fear far longer than facts. Then comes the financial toll. The American Health Economics Review 2024 reported that overtesting and overtreatment among U.S. seniors cost over $210 billion annually. That includes hospital stays, follow-up scans, medications, and procedures that were never needed. But behind that big number are individual lives. Retirees spending savings meant for travel or family, now paying off medical bills for what-ifs. To make a long story short, health paranoia has become expensive. And the worst part? The stress caused by constant testing can actually harm physical health, raising blood pressure, increasing cortisol, and weakening immunity. So yes, overscreening drains wallets. But more tragically, it drains joy. The goal of medicine after 70 should be freedom, not fear. Up next, let's explore the smarter way forward: how to focus on evidence-based, functional, and meaningful health checkups that help you age well without falling into the trap of medical excess. Number 9. The right way: smarter preventive health after 70. So if so many routine tests can do more harm than good, what should seniors actually focus on to stay healthy and live longer? The answer isn't about skipping healthcare. It's about smarter healthcare. At 70 and beyond, your goal isn't early detection of every possible disease. It's maintaining strength, clarity, and independence for as long as possible. Modern geriatric medicine calls this approach functional prevention. It means focusing on the systems that matter most for aging well: your balance, your brain, your heart, and your nutrition. According to the National Institute on Aging NIA, 2024, seniors who emphasize functional health over excessive testing reduce their risk of hospitalization by 28% and experience better daily energy and mobility. Let's break it down. Mobility and balance. Instead of an annual MRI, schedule a fall risk assessment. Studies from the University of Sydney 2023 show that improving leg strength through resistance training cuts fracture risk by nearly 40%. Cognitive health. Rather than scanning your brain just to check, do memory and focus exercises daily. The Harvard Longevity Project found that social activity and learning new skills are stronger predictors of brain health than medical imaging. Heart and blood health. Track your blood pressure, maintain healthy cholesterol, and manage stress. Simple lifestyle consistency often beats any scan in predicting heart longevity. Nutrition and weight. DEXA scans can't compete with balanced eating. A Mediterranean-style diet, rich in omega-3s and plant-based foods, reduces inflammation and protects organs far better than pills and frequent tests. To make a long story short, longevity isn't found in machines. It's built in movement, mindset, and moderation. The smartest seniors aren't the ones getting tested the most. They're the ones learning how to listen to their bodies. Up next, we'll cover something every older adult should master: how to talk to your doctor about skipping unnecessary tests, confidently, respectfully, and backed by evidence. Number 10. How to talk to your doctor about skipping tests. One of the hardest things to do as we age is to say no, especially to a doctor. For decades, we've been told that more checkups equal more safety. So when a physician suggests a test, it feels almost rebellious to question it. But here's the truth. Smart patients don't reject care. They redirect it toward what truly matters. First, remember this: medicine has evolved. Even top organizations like the U.S. Preventive Services Task Force now recommend against certain screenings after 70 or 75. So when you ask your doctor, "Do I still need this test?" you're not being difficult. You're being informed. Here's how to have that conversation with confidence. Step 1. Ask about outcomes, not just detection. Instead of, "Should I do this test?" ask, "How will the results change my treatment or lifestyle?" If the answer is, "It probably won't," that's your cue to reconsider. Step 2. Request evidence. Say, "What do current guidelines say for people my age?" Most doctors appreciate informed patients. If your physician hesitates, mention studies like the Geriatric's 2023 review showing that overtesting offers no lifespan benefit for most seniors. Step 3. Use shared decision-making. That's the key phrase: shared. Medicine today is a partnership. You have every right to balance longevity with quality of life. Tell your doctor your priorities. "I want to stay active and independent. I don't want procedures that could slow me down unless they're absolutely necessary." Step 4. Document your preferences. If you decide to skip certain screenings, note it in your medical file. This avoids repeat recommendations and ensures your entire care team is aligned. To make a long story short, good medicine isn't about testing everything. It's about testing the right things. Your health after 70 should be guided by wisdom, not worry, by data, not default routines. Here's a powerful truth that few people realize. Health after 70 isn't about adding more years to your life. It's about adding more life to your years. And sometimes, that means doing less. Modern medicine has given us extraordinary tools: scans that see inside bones, blood tests that detect molecules, surgeries that can replace entire joints. But these tools were designed to save lives, not to chase every shadow in the body. When we use them without purpose, they can take more than they give: our peace, our confidence, our time. To make a long story short, longevity is not found in hospitals. It's found in your daily walk, your laughter with friends, the food you enjoy, the sleep you protect, and the curiosity you keep alive. That's real prevention. Doctors now agree, at a certain point, the focus must shift from screening for disease to supporting function. The healthiest seniors aren't the ones who spend the most time in clinics. They're the ones who know when to say, "I'm okay. Let's focus on what helps me live fully." So the next time you face a test, ask yourself, will this help me feel better? Will it help me live better? Or will it only make me worry more? Because wisdom isn't avoiding medicine, it's mastering it. And if you've made it this far, you've already taken the most important step: learning how to protect yourself not just from disease, but from unnecessary medicine itself. Your health is your story, and after 70, you get to write it your way.